Welcome back. In this video, we will be discussing the surgical importance of skin tension, elasticity, and how we use tension lines to guide our surgical approach. Let's start. Skin tension and skin elasticity are two important factors to consider in planning your surgical approach. These will ensure the integrity of your skin closure throughout the wound healing process. Skin tension is defined as the normal pull of collagen fibers under the skin, while skin elasticity is how flexible or malleable a skin is to manipulation. These two variables differ in various ways. One is location. The skin on the trunk of a dog and a cat is more elastic and loose as compared to the skin on the limbs. If you have a dog or a cat at home, try observing this characteristic. Pinch the skin on the trunk and the skin on the forearm and see which one is easier to raise from the body. Of course, skin tension would also depend on the breed. Earlier, I told you about the Chinese Shar Pei, which has a normal wrinkly skin. One can say that this breed has a low skin tension and high skin elasticity only because of the extra skin it has as compared to an Aspen. An obese dog may also seem to have low skin elasticity just because its skin is stretched out. Males, having a more muscular build, are also said to have lower skin elasticity than females. In age-driven variations, which do you think has a higher skin elasticity? A puppy or a senior dog? I'll give you time to think. So, which one has more elastic skin? A puppy would have higher skin elasticity because it has a higher water content in its body than a senior dog. But a senior dog can appear elastic because its skin is sagging. More importantly, skin tension is defined by pre-existing tension lines in their bodies. These tension lines are also called Langer's lines in humans. Tension in the skin is determined by the pull of collagen and elastin in the dermal and hypodermal layers. These are visualized as lines of tension. They are usually in perpendicular orientation to the muscles in that area. In the image on the left side of the screen, you can see the orientation of these lines in every part of a dog's body, may it be on the dorsal or ventral side. Imagine the direction of the stripes of a zebra. These show the direction of lines of tension. It is visualized also in this image of a dog with tension lines drawn with white markers. Skin in different regions of the body has varying pliability, thickness, and attachments to underlying fascia. Age, concurrent metabolic disease, and breed type can also affect these skin characteristics. An awareness of skin tension lines is essential when excising masses or closing wounds. In this picture, the skin tension line is running horizontally. The wound incisions are seen as broken lines. The first wound, letter A, was made perpendicular to the skin tension line. This caused the wound edges to be pulled away from each other, which made the wound bigger than it originally is. The same effect was seen if the wound is made oblique, as shown in wound B. Forcing these wounds to close would lead to use of extra suture and incisional discomforts and necrosis. Imagine your suture and the collagen fibers under the skin in a tug of war. Eventually, the suture will cut out and cause your wound to dehisce or open. Now look at wound C. This wound is made parallel to the skin tension line. The wound edges are not pulled away from each other. This wound would be more easily opposed. You can have minimal use of suture, thus a more aesthetic result. The rule: incision lines must be made parallel to the tension lines. Failure to identify tension lines can result in incisional dehiscence, skin necrosis, or even creation of a biological tourniquet on a limb. In the previous video, we learned how to make surgical incisions relative to the tension lines. Now, we must discuss on how to close them. Wounds must be closed or reposed along the long axis of a wound. The wound edges must be manipulated before closure to determine the best direction of minimizing tension. You may see the surgeons here try to approximate the wound edges by pushing them together with their hands before suturing. This is a way to figure out what is the best direction to close a surgical wound with minimal tension and least possibility of dehiscence. When wounds are closed with high tension, skin on both ends of the wound tends to pucker or curl outward, as you can see in these images. We call this skin puckering as dog ears. Dog ears happen more commonly in patients with thick skin. Most would resolve or flatten without excision, but some methods are devised to fix these defects, especially if the dog ears are too big. Now, let me show you the principles of skin closure relative to tension lines with the following series of pictures. This image shows an example of a tumor removal on the left lateral side of the thoracic cage of a dog. A 2 cm mass, the round-shaped shaded area, and a bigger circle around the mass with margins of 2 cm is drawn on an anesthetized dog. The 2 cm margin is what we call the margin of excision. For tumor removals, we must follow safe margins of excision to prevent incomplete tumor removal and make sure that only healthy tissue is left. But in the process, you have to educate the owners about the length and appearance of the incision and consequent scar. When owners see the size of the mass, they often expect that the size of the scar would be the same. It is not so. The triangular lines extending on the dorsal and ventral aspects of the margins are placed parallel to the tension lines to facilitate easier closure, as compared to having a circular wound with no direction for closure. This image shows the surgical area after the mass has been excised. As you can see, the wound edges are far from each other and the defect appears much larger. This white line signifies the direction of the tension line. Let's first try to do a perpendicular closure. We will try to oppose these edges together. In this next image, you can see that the sutures are placed perpendicular to the tension lines, which are marked here as white lines. This closure resulted to a high skin tension, which is seen as a gap between the wound edges. This is very evident on the middle of the incision. Also, this kind of closure, a perpendicular closure, resulted to the formation of dog ears. This is another view of those dog ears. The characteristic puckering of the skin on both wound ends are more evident. To bridge the gap on the middle of the wound, it is closed with a subcuticular suture pattern, but the signs of high skin tension are still evident. In picture A, you can see that the skin around the wound are stretched out and gaps are still seen. In picture B, the tension lines are demarcated as red lines. When we leave patients with this kind of skin tension in their surgical wounds, it is just a matter of time that the wound will dehisce or open, which will lead to non-apposition and non-healing of the wound. It may also cause infection, seed into the gaps, and cause more harm to the patient. Now that we know the consequences of wound closure perpendicular to the tension lines, why don't we try a parallel closure? If the wound is closed parallel to the tension lines, no gap is evident, and wound apposition is achieved with minimal suture used. With parallel wound closure, there is no skin tension on the middle of the surgical wound. No dog ears formed, and minimal suture was needed. After wound healing has occurred, an excellent skin apposition was seen on the patient's recovering body, as seen on the image on the left. There's a smooth skin appearance, and we also expected faster healing with minimal scarring.